Hello, welcome. My name is Karen, and I am here with my friend, Dr. Richard Gordon. He has a remarkable personal story about his experience with ulcerative colitis that I can't wait for him to share with you. And, it's my understanding that Dr. Gordon is the very first person to have his UC completely resolved after receiving a brand new treatment developed by a Dr. Pravda. I cannot wait for him to, I'm so excited about this interview. So, Dr. Gordon, with that, can you just share with our audience just a little bit about yourself?
Sure. And first of all, I'd like to thank you for having me on your podcast, Karen. I'm a board certified cardiologist, but for the purposes of this interview, just think of me as a patient with ulcerative colitis. I'm 60 years old now. I live in Arizona. I practice part-time, and the other parts of the week, we either go climbing or bicycling, and we try to stay physically active with my wife. I have 4 children, a grandchild, and one on the way. And when we can, we try to travel around the world when we get an opportunity. All things I used to not be able to do, but these are things I'm enjoying nowadays.
Wow, that's amazing. So you're the first person to have received this treatment and to, have his UC be completely resolved. And you just happen to be a doctor. You just happen to be a board certified cardiologist, um,
Right.
which is really cool. Wow. So, okay. Well, thanks for sharing a little bit about that with us. Um, I think there was something that we wanted to announce to our viewers too, that we have a surprise in the middle of a little bit later in the video. So that'll come, not too long. So stay tuned, but we do have a surprise for our viewers that I can't wait to announce. Dr. Gordon, tell me just a little bit about when you were diagnosed and how you were diagnosed.
Okay, well, I was first diagnosed at approximately age of 19. I was at University of Massachusetts. I was working hard. I was pre-med, pretty intense with my classes. And I had just applied for and was appointed as a resident assistant. So needless to say, I was under a lot of stress. And then I started to notice I was having abdominal bloating and discomfort. I had a lot of pain with my bowel movements, diarrhea. And finally, I developed some bleeding. I'm not sure why I didn't go to the infirmary on campus at that time, but I called my folks, and they basically that day drove up and brought me home the Washington, D.C. area. And then I was diagnosed by colonoscopy with a biopsy, and that's how
Okay.
the diagnosis was made.
I see. Wow. And so how long did you have UC exactly?
Well, before I received Dr. Pravda's treatment, I had UC for about 25 years before I got his treatment. Um, and it's important to state, I think, that the treatments I did receive over that 25 years were high dose oral steroids because I had a rather moderate to severe case. And this had a lot of effects uh, on my well being and health. It caused me to gain a tremendous amount of weight. My face got puffed up. I got acne and generally didn't feel well. So I would go into remission, and then time would go by, and then I'd flare up again and go through the whole thing trying to wean off the steroids and then having to go back on higher levels, et cetera.
Yeah. Wow. Okay. So 25 years you had colitis. For some reason, I
Well,
thought,
I technically have had it for over 45 years, but until I got better, uh,
okay, gotcha.
it was 25 years.
Wow. Okay, I see. After you started taking this treatment that Dr. Pravda came up with, and you can share a little bit about what that treatment actually is and looks like soon. But how long after you started taking the treatment did it take you to improve? When did you start seeing noticeable
Oh,
results?
well, about 14 to 15 years ago, I received a treatment. I was seeing a local gastroenterologist who was working closely with Dr. Pravda. and they asked me if I wanted to be part of a study. And they biopsied my colon, and I certainly had one of the worst cases of ulcerative colitis they had seen. And then
Wow.
I took Dr. Pravda's treatment, and within a few days, certainly by a week, I was feeling better. And then they rebiopsied me at about, I think, I want to say 6 weeks, and the biopsy came back all normal.
Wow. That's incredible.
My symptoms had completely resolved.
Wow. Okay. And how bad did it get for you? Like what at your worst?
Oh,
What were
well.
your symptoms? Tell us a little bit about.
So about 13 to 15 years ago, I had my own cardiology practice. I was working extremely hard, and it was quite bad. I got to a point where I had urgency and something called tenesmus, basically a painful, very painful bowel movements, bad diarrhea. I always had to know where the nearest toilet was, and I also had some degree of bleeding. So it was pretty bad.
Yeah. Wow. And I think you shared with me at one point you were not too far off from a colectomy. Is that correct?
Yes, my gastroenterologist had said that we may need to start thinking about getting a colectomy if we couldn't get it under control with the available agents. So I would say probably weeks to months from having a colectomy.
Right. And I think you were taking a lot of like 6-NP, trying to get your symptoms down and steroids, and
Yeah.
nothing was really working, right?
Yeah, the 6MP was my fault. Being a doctor, even though I'm not a gastroenterologist, I thought I'll try this. I actually had a bad reaction, and it wasn't, in retrospect, wasn't such a good idea that I did that. But yes,
Oh,
I
okay.
tried all different types of agents.
All the things, nothing worked. Yeah. Wow. So that's incredible that the treatment worked so quickly for you. What exactly is this treatment? Can you share with us just a little bit about what it is?
Right. Well, I'll tell you what I know about it. I don't claim to be a gastroenterologist or scientist, but I have been keeping up with the literature. But basically, Dr. Pravda discovered that ulcerative colitis, or just UC, I'll call it, is caused really by excess hydrogen peroxide in the colon. And that he was able, after studying all about this, identify what we call a reducing agent. It's called R-dihydrolipoic acid, or just say RDLA. And what it does is it allows people with UC to eliminate the excess hydrogen peroxide in the colon, which allows the colitis to resolve. Or to put it another way, in people with ulcerative colitis, they make too much and they don't have the reducing capacity to eliminate it, so it leaks out and does destruction locally in the GI tract, and that's really the cause. And that's important because some of the hypotheses today that are offered up seem to implicate primary immunologic problems with people with UC, and that simply does not seem to be the case.
Yeah. Wow. Okay. And so let me ask you I mean, if this treatment was so effective for you, I mean, you clearly got your life back after many years of a debilitating disease. I'm sure it was hard to practice medicine while you were that sick. I mean, goodness, I'm sure it was hard to.
Oh, it was miserable. I was able to do it, but it was very difficult. As I stated earlier, having to have abdominal discomfort, having to go to the bathroom on some days quite frequently. So I was able to do much of what I needed to do, but it was very difficult.
It was challenging, I'm sure. Yeah, and I'm sure
Once I received the treatment, it was like I couldn't believe it. It was like I'm having normal bowel movements, everything's back to normal. And everybody once in a while gets an upset stomach. And I remember thinking, it's been about 14 years or so since I had the treatment. And I remember thinking if I had a little bit of an upset stomach, oh my gosh, am I having a flare?
right.
And it was just everybody can have an upset stomach for a little while, but clearly it was never that. And I've never had a flare ever since I received that treatment.
That's incredible. That's just so incredible. So if this treatment's so effective, which clearly it is, let me ask you a question. Why do you think the treatment hasn't been made more widely available?
Yeah, just before I say that, I want to include one piece of information that's important. In 2019, I had my latest colonoscopy with biopsy,
Oh, oh,
and that basically showed completely normal. In fact, the gastroenterologist, which was a different one from the one I initially couldn't even tell that I ever had after all those years that I ever even had colitis, which I clearly did because it was documented. But that's important.
yeah, no, that's key information. Thank you. Wow.
Yeah.
Hmm.
So actually, Karen, I understand that you have a surprise for our viewers.
I
Can you
do.
tell us
I
a little
do.
bit
Thank you
about
for
that?
reminding me. I do have a surprise for our viewers. I can't wait to share. So the surprise is that I happen to be the second person whose UC is completely resolved from Dr. Pravda's new treatment. So
Wow.
I say that with a huge smile on my face. How could I not? But yeah, I did Dr. Pravda's treatment, and I am a sitting here walking testimony of complete recovery.
Can I ask you a few questions because that's very exciting?
Yeah.
When were you actually first diagnosed?
I was diagnosed when I was 15, the ripe old age of 15 years old. I remember the day very clearly when I actually started bleeding is because I was actually shopping for my first prom dress that day. So that was a bit an important day for me and exciting day for me and yeah I was and that evening I was in the bathroom losing blood, and really my symptoms probably started around 12 years old. I remember my last year of grade school of waiting for the yellow bus and waiting at the bus stop, and then all of a sudden having to run home, and I would miss the bus and my mom would be so upset, but I just couldn't help it. I had to run home to get to the bathroom. So the urgency actually started around age 12 or 13, and just not digesting food well and diarrhea on and off. So I was definitely experiencing things earlier than my diagnosis, but I started losing blood around age 15. I told my mother. Oh, I'm sorry.
I'm sorry. I just want to make sure I understand. How did they actually diagnose you?
Oh, yeah. They diagnosed me through colonoscopy and biopsy. Yeah. But it just, it's just kind of funny because I told my mom I was bleeding, and she told me I had hemorrhoids. My mother was a very sweet woman, but she didn't know what was going on. So when I first told her I was bleeding, she told me I had hemorrhoids, and she gave me, hemorrhoid medication for like 3 or 4 months, suppositories, and,
Okay.
taking them thinking, oh my God, 15, you're mortified that you think you have hemorrhoids right before you go to prom. And, but yeah, so she finally took me in and I got diagnosed properly with the colonoscopy and biopsy.
Okay, so I understand you also received, as you said, Dr. Providence's treatment. And how long did it take for your ulcerative colitis to resolve after taking his treatment?
Yeah, so I started seeing improvement for sure after 3 to 5 days. I absolutely noticed things were changing. So some of my urgency started to dissipate. The pain and cramping started to dissipate. I was all of a sudden just started tolerating food better, which is just unusual for me. Um, and then that just continued. So a week into the treatment, I had almost no urgency. By 2 weeks into the treatment, I was almost normal, I would say.
Wow, that's great. How bad did your UC get before you received the treatment?
Good question. Pretty bad. I mean, by the time, so it really progressed for me. I kind of skated through my teens and 20s on a really popular drug for colitis called mesalamine 5-ASA. But then by
Yes.
the time I got to my latter 20s, it just stopped working. And so then came the steroids. And in my 30s, I was hospitalized like 3 times with UC. And they would put me on 100 milligrams IV steroids every time I was hospitalized. So I'd, blow up like a blowfish. And you can't live on steroids. You can try, but it doesn't quite work. It causes a lot of problems. So then came, 6-MP, like you took. I tried that for a couple of weeks, didn't tolerate it at all. Side effects were horrendous. So that didn't work. So, the next step was a biologic, which I never wanted to consider. But, I was just dripping blood all the time, so much pain and cramping. I got down to, I'm a small framed woman naturally. So a healthy weight for me is, 105, something like that. But I got down to like 82, 83 pounds every time I was hospitalized with colitis. So 20 pounds less than I weigh, right now. And that's a little scary, but I just couldn't eat, the eating was so painful.
So let me ask you, how close were you to having a colectomy?
Well, the doctors kept bringing, every time I was hospitalized, especially into my 30s, they kept trying to have that conversation with me because, if nothing's working and you're bleeding and you can't eat and you keep getting hospitalized, obviously the next conversation is, colectomy. But I just kept shutting them down because I just couldn't swallow going that direction. I just wasn't mentally ready. So, but I would say pretty darn close if it were up to the doctors, I was, I was miserable. My life was just revolved around trying to find the next bathroom as yours did. And I really didn't get to do a lot of things in my 30s that, most women were doing. It's almost impossible to date when you're, dripping blood and just trying to find a bathroom and you're in so much pain, you can't eat, so I didn't get married. I didn't have children. I missed a lot of those years.
Yes, I could definitely relate to that. In college, the last thing I wanted to do was go on a date
Yeah.
when I was sick. So I definitely get that. Now,
Yeah.
I just to clarify, can you tell us when you started to take the treatment, how long ago, and how have you felt since? Have you got sick since, and how long has it been?
No, I have not gotten sick since the treatment. It has been a little over a year. I first started the treatment in November of 2021. So it's been a little over a year. And nope, I have just progressively gotten better and better. I've gained a little weight, of course. My diet has expanded immensely because my diet was so limited previously. And for sure, my mental health has improved. Goodness, when you're that sick, obviously that comes along with, depression, anxiety, and just all the things that a chronic illness often brings.
Yeah.
So yeah.
Let me just clarify. So, but when you said you gain weight, you mean in a healthy way?
Oh, yes, absolutely. Yes. Yeah.
Okay, I got you. And then can you tell us to verify that the UC was resolved after your treatment? How did you know that?
So they did a stool calprotectin test on me, which essentially it's a marker to show the levels of inflammation for people with IBD, and my stool calprotectin is completely normal.
Oh, that's wonderful.
Yeah. Yeah, it really is. It's a different world, obviously.
Now we got to get other people to benefit from this.
Oh my goodness. I can't wait. Can't wait. I'm so glad that we were able to do this interview because, there's a lot of information that we're sharing, in this chat that we're having. I think the biggest thing though that I want to impress, and I know you do too, is just that there's hope. And not just hope, but there's, there are real solutions to this disease, and I know that in the not too distant future, these solutions and this treatment is going to be available, and people with UC aren't going to have to be sick anymore. And I promise I'll spend the rest of my life fighting for that. I promise you that. which is also why I'm doing this interview with you. So there is hope, and you and I are clearly, examples of that, which just brings me enormous happiness to share that with everyone. So thank you so much for sharing your story.
Sure. Thank you, Karen, for inviting me to this podcast. I think the short and long-term solutions, most if not all of them, I totally agree with. I think that the practitioners who carry out gastroenterology refer to guidelines and what's recommended by the experts, and that's all generated from research and evidence. So I definitely believe we're living proof that Dr. Pravda's new treatment needs to be provided with adequate funding to see if it's true, because really the winners would be the patients who, I mean, it's a bad disease. And a lot of times, like you stated, and I stated, it comes at the prime of life when you're supposed to be having a lot of fun and thinking dating or family. And that's the last thing you think about when you're afflicted with this disease. So once again, I want to thank you. And also add that if I could be of any further help in the future, please don't hesitate to contact me, because I want to see these people get better. It's very frustrating for me because as a practitioner, as a cardiologist, I see quite a few patients, and I run into patients who happen to also have ulcerative colitis or have children. In fact, I had one fella, his son, I think he was in his 20s. He was diagnosed and within a month underwent a proctocolectomy. And he was supposed to go to graduate school and do all these other things. He was going to get married. And this really, getting back to what you said about psychological effects, really did a number on him and his family. So, I'm not saying there's not cases where people don't need surgery. I mean, that's for the doctors and them to work out. But if you have something that potentially could cure that situation in the first place, by all means, it should be explored entirely. So I'm with you. And once again, thanks for having me on the podcast.
Yeah, absolutely. And, I look forward to maybe there's another time we can, have more dialogue as things progress, and we can revisit, these topics, and yeah, hopefully, over time, bit by bit, slowly but surely, progress will be made, and you and I can revisit those things and share. So thank you so much. Yeah, thank you so much, Dr. Gordon.
Thank you. Have a good day.
Okay, you too. Bye-bye.